Is Benadryl safe? The hidden dangers, safer alternatives. Is it time to reconsider the safety of Benadryl? Recent discussions among health experts suggest that the potential dangers associated with diphenhydramine, the active ingredient in Benadryl, may warrant its removal from store shelves. This conversation is particularly urgent given the alarming trend of the so-called Benadryl challenge, which has tragically led to overdoses and even fatalities among teenagers. In September 2020, the FDA issued a stark warning regarding this dangerous social media trend, which involved young people taking excessive doses of Benadryl to experience hallucinations and then sharing their experiences on TikTok. The FDA cautioned that consuming higher than recommended amounts of this widely available over-the-counter allergy medication can result in severe health issues, including heart complications, seizures, coma, and potentially death. In light of these incidents, Dr. James Clark, an assistant professor at Johns Hopkins University, along with his colleagues Dr. Eli Meltzer and Dr. Robert Naclerio, has called for a thorough evaluation of diphenhydramine. They propose that it may be time to replace it with second-generation antihistamines, which offer similar benefits but with a significantly lower risk of adverse effects. Dr. Clark emphasizes the long history of diphenhydramine, which has been in use for nearly 80 years and has provided relief for countless individuals. However, he also highlights the critical role pharmacists play in educating patients about the potential risks associated with this medication. Pharmacists often have direct contact with patients and can help ensure they are informed about the dangers of misuse. He notes, diphenhydramine is frequently used to treat a variety of conditions, including allergies, insomnia, itching, hives, vertigo, motion sickness, and certain movement disorders. Since its approval as the first antihistamine in the United States in 1946, it has been included in over 300 different products, ranging from allergy medications to sleep aids. While exact sales figures are hard to come by, estimates indicate that there were over 1 million prescriptions for diphenhydramine in the U.S. in 2022 alone. As an H1 receptor agonist, diphenhydramine works by counteracting the effects of histamine, which is responsible for allergic reactions. However, being a first-generation antihistamine, it can cross the blood-brain barrier, leading to additional side effects. Dr. Clark points out that it possesses anticholinergic properties, which can result in symptoms such as confusion, dizziness, urinary retention, dry mouth, constipation, and blurred vision. Furthermore, long-term use has been linked to an increased risk of dementia. The therapeutic window for diphenhydramine is quite narrow, meaning the difference between a safe dose and a toxic one is small. This raises concerns about the potential for abuse, especially since the drug is easily accessible. While some overdoses may stem from self-harm or suicidal thoughts, others may be motivated by the desire to achieve a euphoric high. Symptoms of an overdose can include delirium, agitation, confusion, hallucinations, tremors, seizures, flushed skin, blurred vision, urinary retention, and rapid heart rate. If someone ingests a dangerous amount, decontamination methods such as administering activated charcoal may be considered within an hour of consumption. Unfortunately, there is currently no antidote for diphenhydramine toxicity, and treatment primarily focuses on managing the symptoms, which may involve using benzodiazepines for seizures or sodium bicarbonate for heart rhythm issues. In contrast, second-generation antihistamines like cetirizine, Zyrtec, and loratadine, Claritin, have been shown to have fewer side effects, while fexofenadine, Allegra, appears to have none at all. Dr. Clark notes, evidence suggests that these alternatives provide comparable therapeutic effects. It's essential to consult with healthcare providers and consider other options, such as nasal steroid sprays, which can effectively alleviate allergy symptoms. When it comes to sleep, Dr. Clark warns that while diphenhydramine may help individuals fall asleep, it does not guarantee restorative sleep. He recommends consulting a sleep specialist for better solutions. Pharmacists are crucial in guiding patients through the maze of over-the-counter allergy medications. They can help identify potential drug interactions and assist patients in managing their allergy triggers effectively. Dr. Clark highlights the trust that community pharmacists build with their patients, often being the only healthcare professional they consult when selecting over-the-counter treatments. Moreover, pharmacists can play a vital role in disease prevention, health maintenance, and addressing health challenges, thereby enhancing access to necessary treatments. However, Dr. Clark raises a valid concern. Pharmacists have numerous responsibilities, and it's unclear how much they are recognized for their educational efforts, especially when they face so many competing demands. Finding ways to incentivize pharmacists to provide education is essential. As we navigate the complexities of medication safety, it's crucial to consider whether the benefits of diphenhydramine outweigh its risks. Should we continue to allow this medication to be readily available, or is it time for a change? What are your thoughts on the potential dangers of diphenhydramine? Do you believe that second-generation antihistamines could be a safer alternative? We invite you to share your opinions in the comments below. Benadryl, diphenhydramine dangerous? Doctors warn against outdated medication. Safe alternatives. Doctors are raising alarms about a widely used allergy medication, labeling it as outdated and dangerous. This warning comes from a recent review conducted by allergy specialists from two prominent universities, shedding light on the potential risks associated with this common drug. The medication in question is diphenhydramine, which is most commonly recognized by its brand name, Benadryl. Medical professionals are increasingly advising against its use due to significant concerns regarding its safety and effectiveness. Experts are urging individuals to explore safer alternatives that are currently available, such as Claritin and Allegra, which may provide relief without the associated risks. Furthermore, they recommend that Benadryl should be restricted to behind-the-counter sales to ensure that consumers are more cautious about its use. The review pointed out that Benadryl, along with other medications containing the same active ingredient, can cause sedation, impair cognitive functions, and in some instances, lead to serious heart-related issues. In response to these findings, the Consumer Healthcare Products Association issued a statement on behalf of Kenvue, the manufacturer of Benadryl. They emphasized the importance of using the medication responsibly and reminded consumers to adhere strictly to the instructions and warnings provided on the product label. But here's where it gets controversial. Should we continue to rely on medications that have been deemed outdated? Or is it time to fully embrace newer, safer options? What do you think? Are you willing to reconsider your go-to allergy relief? Share your thoughts in the comments below. Why Benadryl is risky for allergies. Safer alternatives you should know. The risks associated with common allergy medications, particularly diphenhydramine, may outweigh their benefits, according to experts in the field. Dr. Anna Wolfson, an allergist at Massachusetts General Hospital, frequently encounters the dangerous misuse of diphenhydramine in her practice. She notes, when someone experiences an allergic reaction to food, people often say, "Don't worry, I have diphenhydramine in my purse." However, I must emphasize that epinephrine is the primary treatment for food allergies. Dr. Wolfson warns that taking diphenhydramine after a food allergy reaction can be harmful. This medication, commonly known by its brand name, Benadryl, can induce drowsiness, which may prevent individuals from recognizing that their symptoms are worsening. It's time to move on from diphenhydramine for every situation where it is used. There are more effective medications available that treat symptoms with fewer side effects, she asserts. She has observed patients whose ability to drive or engage fully in daily activities was compromised by this medication. Dr. Wolfson's concerns are echoed by a review published in February by allergy specialists from Johns Hopkins University and the University of California, San Diego. They advocate for the removal of diphenhydramine from both over-the-counter and prescription markets in the United States, labeling it as outdated and dangerous. Overshadowed by safer alternatives. Diphenhydramine, a first-generation antihistamine approved in 1946, is commonly used for allergies, as a sleep aid, and for cold symptoms. Its use tends to spike during the summer months when people seek relief from bug bites, poison ivy, and seasonal allergies, as noted by the American Pharmacists Association. Despite its long-standing presence in American households, the authors of the recent review argue that diphenhydramine poses greater risks, particularly for children and older adults, compared to newer antihistamines. Dr. James Clark, the lead author of the paper, and a member of the Department of Otolaryngology Head and Neck Surgery at Johns Hopkins University School of Medicine, recommends alternatives such as loratadine, Claritin, cetirizine, Zyrtec, or fexofenadine Allegra for managing allergy symptoms. The Consumer Healthcare Products Association, representing the over-the-counter medicine industry, acknowledges that the side effects of diphenhydramine are clearly stated on the product labels. However, they emphasize that these medications are not intended for prolonged use. When used as directed, these medications provide well-established therapeutic benefits for common health issues like allergies, the common cold, motion sickness, minor skin irritations, and occasional sleeplessness. The group stated on behalf of Benadryl's manufacturer, Kenvue. They stress the importance of responsible use and encourage consumers to adhere to instructions and warnings on the drug facts labels, as well as to consult healthcare providers with any questions. Antihistamines function by blocking H1 receptors, which are part of the body's response system to allergens that cause symptoms like sneezing, itching, and a runny nose. However, older medications like diphenhydramine not only block these allergy-related receptors, but can also impact other areas of the brain. This often results in sedation, cognitive impairment, and, in some cases, serious cardiac issues. In older adults, diphenhydramine can remain in the system for up to 18 hours, leading to prolonged drowsiness, confusion, and an increased risk of falls. The review also pointed out a potential connection between long-term use of diphenhydramine and dementia. For children, the risks are even more significant. The review highlights instances of accidental overdoses, paradoxical reactions such as agitation and extreme sedation, and even fatalities, particularly with pediatric formulations due to accidental ingestion. The medication has been linked to numerous hospitalizations and deaths among children during the viral Benadryl challenge on TikTok. Dr. Manuela Murray, who directs general pediatrics and urgent care at the University of Texas Medical Branch, cautions against the casual use of diphenhydramine. It should always be administered under the supervision of a medical professional and is only indicated for treating allergic reactions and motion sickness, she stated in an email. Dr. Murray also pointed out that diphenhydramine does not effectively treat cold symptoms and is not a safe sleep aid. In fact, it can lead to hyperactivity in children. Dr. Alyssa Kubin, a pediatrician and associate medical director at Texas Children's Pediatrics, agrees that diphenhydramine is often overused for symptoms it does not effectively address and that there are safer alternatives available. I often see families using diphenhydramine when their child has a cold or upper respiratory infection, believing it will alleviate congestion and help them sleep better at night, she explained. This is not an effective treatment for cold symptoms and is not very safe. Dr. Kubin recommends cetirizine for children suffering from hives, seasonal allergies, or itchy rashes, noting that it lasts longer and is less sedating than diphenhydramine. Dr. Murray concurs that loratadine and cetirizine are safer options for children over 6 months old. While saline drops and suctioning are preferable for infants, diphenhydramine is found in over 300 over-the-counter formulations, often combined with other ingredients for coughs, colds, and flu. The authors of the review suggest that, similar to products containing pseudoephedrine, diphenhydramine should be kept behind the counter, allowing pharmacists to direct patients towards second-generation alternatives. The American Pharmacists Association advises caution when using combination cough and cold products that include diphenhydramine. Pharmacists may suggest alternative medications for older adults who have previously experienced cognitive side effects from certain drugs, and they encourage patients and caregivers to consult their pharmacist for the most suitable treatment options with minimal side effects. The review's authors also stress that there is no robust clinical evidence indicating that diphenhydramine is more effective than other alternatives. While it may alleviate symptoms like sneezing and itching, it has little impact on nasal congestion and does not outperform second-generation antihistamines in randomized trials. Newer medications such as oral cetirizine provide 24-hour relief with fewer adverse effects. Despite this, diphenhydramine remains a common choice in the United States, with over 1.5 million prescriptions written annually, not including untracked over-the-counter sales. Historically, Diphenhydramine has been a valuable medication that has benefited millions of patients. However, its current therapeutic effectiveness is matched or surpassed by second-generation antihistamines, particularly due to their significantly reduced side effects. It is time to bid farewell to diphenhydramine as it poses a public health risk, the authors concluded.